So basically, interestingly, that same year in 2020, I think, no, 2021, when you gave the talk, there was a founder of Refractive Surgery Alliance who was in the audience. And when I came off the stage after doing the young ophthalmologist session and the sustainability session, he said to me, I think I may have a role for you. I said, I've just started my career. I mean, what kind of role can I play? He said, no, I think you'll be good for this. Okay, then we go home. I get a call from him, and I'm like, oh, okay. He says, I want you to be the associate academic director of this new fellowship network. And at that time, we had 9 fellows in maybe 3 or 4 different countries. And they were looking at revolutionizing the way we train refractive surgeons. Now, of course, I've already been a corneal surgeon for several years, already did refractive surgery training at Moorfields, and actually it was more hands-on than a lot of the other people were getting. So David Gartrey taught me how to do LASIK, and he was one of the first people in the UK to do LASIK. I've used the Visex, I've used the Intralays, I've used, so I've really been on that cusp of that. But, I can't say I've done, 1,000 of this or that. But I was like, Guy, what can I bring? And interestingly, there was a lot we could do because obviously cornea, cataract, refractive, they're all intermixed, right? And a lot of people you see, they're doing refractive surgery without doing cornea surgery. And I don't understand how you can do that, truly. Maybe I'll annoy a lot of people by saying that. But anyway, my role was this. So Helen Wu, who works at Tufts, she's the academic director. She's got 30 years of refractive surgery experience. Excellent. And then me and 2 other people who are, again, at the kind of beginning of our refractive surgery career, were there. We were organizing pop quizzes. We were organizing the speakers, the best speakers from all over the world on that particular topic. I also spoke on high order aberrations because I'd done some work on it. So it was really a rare opportunity because I was learning and teaching and organizing at the same time. And it gave me this interesting overview of refractive surgery and the state that it's in right now globally. Fast forward 2 years, I've just done 2 years of this position. Again, I didn't shout about it on social media because I was feeling actually, we were talking about something about imposter syndrome, I don't want to shout about it because I'm not an expert in it yet. But next year, ask me. I'm excited because now I have all these tools. I've already done all this. I kind of did it in reverse. Most people do lots of things and then they get into this position, but I learned at the same time. And you have to embrace that and say, yeah, I don't talk about anything I don't know on the podium. I'm very open and honest, but I'm excited about the next phase. So as well as being a corneal surgeon, a cataract surgeon at both Royal Free and Moorfields, at Moorfields, actually, I do more triage, and I'm working on some stuff with Pete Thomas for digital twin of triaging. So it's quite interesting. And then I was having this position as well. So every Friday night at midnight, I would meet with Guy Kazarian and Helen Wu, and we would speak for an hour to plan everything. And then the next day, most Saturdays, 3-4 hours, we would spend immersing ourselves in refractive surgery. Now we have 26 fellows from 13 countries, 5 continents. And, I even convinced Pooja. She's got a fellow with Rohit, and we've got Florian Kretz. We've got all these American people, and lots of people from South Africa, So this is what we've done. But there was a need for it. Why? Well, myopia is growing. And really, it accounts for 45% of visual impairment, refractive error. Why are we not treating this? Then there's not enough trained refractive surgeons because we're all doing it as an extra on the side. It's not being treated as its own specialty, which actually it should be now. There are more than 8 procedures you can do in refractive surgery now. And even then, you might do hundreds of them and still not be yet an expert because of, the way that technology is improving all the time. Now, I've learned Lalex or Smile, but some of my predecessors don't do it because they never learned it. So we're at the cusp of this era where you might become the actual expert in it. And then in 10 years' time, they will say, oh, remember when it started? And you are at the forefront. So there's advancing technology. It's safe. We understand the ocular milestones better. We're able to explain the ocular milestones to the patients better. And we have the imaging. We have great, accurate, safe lasers. But if you ask any person on the street, they still think it's dangerous. Communication is a problem. Then there's the market overview. Okay, we're poorly differentiated. There's lots of chains that are failing. They're providing substandard care. They're having issues. They're ruining the name of refractive surgery in some cases, being hushed away with money and whatever. And It's not the way it should be. We need to standardize things. And so we realized that for surgeons, not here, obviously, there's poor training. They usually have 1 or 2 years of fellowship. Most fellowships don't train them fully in all the different things. They might not do ICLs, they might not do LALEX. And then there's limited training. And of course, it's dependent on how good your preceptor is. You know, if you have a good preceptor, great, you're enjoying life. But if you have not so good preceptor who doesn't explain the didactics, you'll just make the same mistakes they do. And there's limited surgical volume. There's lots of platforms available now. There's a Refractive Surgery Alliance, which I'm involved in, and there's ISRS, Ophthalmo University. The list goes on. There are lots of things you can do, but they're not really focused. Each one of them on its own weren't focused on the right thing, which is actually how every single fellowship should be. What's the perfect fellowship? You do the cases in the week. You train in didactics in the evenings or the weekend. You already do that actually quite well. And then you have the top speakers from around the world, and you're interacting with them and with other colleagues around the world in your specialty for a few hours, and you get to know them. You get to know them over the 2 years. Then you do business training, which is interesting as well. These are all the different, things that I follow, where I'm looking at what they're doing, what they're up to, and it's quite interesting. So that's a traditional fellowship, and that's the fellowship that I have been helping with. And actually, a lot of those things you already provide here, but we also do physician CEO, which is a business training. So every refractive surgeon, actually every medic, every doctor should be aware of business training. Operational efficiency, finances, what does EBITDA mean? What does, how do you run a place, And there'll be a few people who learned it themselves, but actually there's training. So I got a scholarship to do the physician CEO program last year at the Kellogg Business School of Management, and it was an amazing experience. People from all over the world teaching you. And that's how I negotiated my private practice deal this year. Yeah. So, and then in the end, you get accreditation from the World College of Refractive Surgery, which is a new entity. And so this was the academic directors, and of course the founder, Guy Kazarian, and Helen Wu, who's at the beginning, she's the academic director. So it's all about time for standardization, really protecting the fact that these are precise and accurate and safe procedures. If we do it in a standardized manner, you can really, really have great results for the patients, and then patients will tell other patients and they'll come. They already do come, actually. But I think that we are only taking a very small bite of the market at the moment. And the World College of Refractive Surgery was founded in 2021. And now it's being chaired by Arthur Cummings. And I spoke to him this afternoon. And I said to him, Arthur, I'm going to be talking about the World College. This is what I'm going to say. I'm going to say this is the future, about standardization, about how we need to work together to really make refractive surgery its own thing. So this is the laser you have here. Get to know it. You need to know it inside out. You need to understand it. You need to understand why you put the numbers in, how you put the numbers in. The pressing the pedal is not hard. It's the planning. It's the conversation with the patient. It's the assessing of the managing the expectations. You will have 6-6 happy, 6-5 happy, whatever. Yeah? But they have to have the right expectations. So I think it's time for one of you or all of you to stand out. Thank you.